Children that are born in poverty have a higher risk of all kinds of health problems.
In Pueblo, we're one of the communities in Colorado with a high teenage pregnancy rate.
We see child abuse and neglect, substance abuse, lack of access to prenatal care.
These moms come from a lot of life experiences you and I have never seen and couldn't even imagine.
The Nurse-Family Partnership is a nurse home visitation model. Registered nurses come into the homes of first-time, low-income mothers on a voluntary basis, working with them from their pregnancy through their child's age 2.
The moms in the Nurse-Family Partnership program are really the highest risk, most vulnerable moms that we see in our state.
This is a program that has been researched over 3 decades with 3 different populations in 3 different geographic areas.
Nurses have the opportunity to work with clients in all aspects of their lives. It's not just acute health issues.
And consistently, we're seeing a reduction in child abuse and neglect, an increase in the health and development of the children, and increases in their parents' long-term self-sufficiency. The Nurse-Family Partnership has a wide range of people supporting this program. We have folks who understand early childhood health and development.
Folks from the judicial services, from schools, from community colleges.
We have district attorneys, business leaders, people in the media, people in faith-based communities. A lot of people that understand getting kids off to the best start possible is the best place to make this investment.
I met Shanae when she was in her 2nd trimester of pregnancy. Chris and Shanae were juniors in high school, I think. They really didn't like their living situations because of the substance abuse both families had. So they decided to run away for a few months. Of course, Shanae came back pregnant.
When I found out I was pregnant, we weren't in a good environment to have a kid. I didn't want to tell my family because I knew they wouldn't have been supportive. I was just nervous and scared because I was only 17.
I found that there was a huge learning curve with her related to caring for a child.
We just took a ton of classes to try and make it so we could be as best parents as we could, and she helped out a lot too. She helped us find other resources such as finding place for like homes and like food resources and stuff like that. If she wasn't here to keep us in line, he probably wouldn't be going to work and I probably wouldn't be going to school.
Invest in Kids has been able to affect the lives of so many vulnerable first-time mothers and their children simply because of the investment that the Colorado Trust made in us. We were able to turn around and work with the Colorado General Assembly, work with the state legislature to educate them about the important work that we had been doing and that the Trust had been funding. And they shared our vision for Colorado families.
Family Partnership Program has been way worth it because I don't think I'd be as half of a good as mom as I am now.
In my 23 years, I have to say it's been one of the most rewarding jobs I've ever had.
It's a relief to have her here because I just need that support and help and to get through my life because it's really tough.